It is just a huge honor for me today to be podcast interviewing Dr. Eyal Simchi. He's a pediatric dentist at Riverfront Pediatric Dentistry in Elmwood Park, New Jersey. He does dentistry differently. He's a trailblazer in the use of new and innovative techniques focused on improving his patients' experiences. He gained worldwide attention for his use of magic in dentistry. He attended UMDNJ, University Medical Dental New Jersey. It's the old Rutgers school. So it was Rutgers for my first 30 years of being a dentist, but now they changed the name to Rutgers. No, it used to be Rutgers.
No,
it used to be UMDNJ.
And then they switched to Rutgers, yeah.
Okay, so the coronavirus affects the head. It got in there. Where he was elected to serve on the ethics committee. Dr. Simki, I know you pronounce it. How do you say it? Simki? Say it again.
Simki.
Simki, it's the back of the throat thing. Oh my gosh. Like I said, I tell everyone, the only D I ever got in my life was in Spanish, and my piano teacher actually fired me as soon as she told my mom I couldn't carry a tune in a lunch pail. And my mom thought I was going to be sad, and it was like the happiest week of childhood when you get out of piano lessons in Spanish in 1 week.
Absolutely.
So Dr. Simki excelled in prosthodontics. A childhood full of brothers and sisters established his true passion, pediatric dentistry. He went on to complete a 2-year pediatric dental residency training program at Maimonides Medical Center. He then continued to advance his specialization by becoming board certified. Having completed his training, he has worked in several prestigious pediatric dental offices before having the opportunity to open Riverfront Pediatric Dentistry. He continues to advance his knowledge in pediatric dentistry with continued education, incorporating latest technologies and techniques from all over the world. He is a noted expert on healthtap.com and lectures on different topics related to pediatric dentistry. He was featured in the New York Times article on the use of silver diamine fluoride. Was that the same issue that Jeanette was in? Jeanette McLean?
Yeah.
Who's the rock star pediatric dentist of Arizona. But by God, everybody I know and everybody on Dental Town knows you. You did a magic video deal that I think had like 100 million views, and every time. And I don't know how long it goes, but I looked for the original video. So, I have programmers. So I actually stole the video and posted on Dental Town. Everybody knows you in pediatric dentistry. Everybody loves that video. And then you did a new video recently. But,
he came back.
Start with that, because 100 million downloads. I don't think Paul McCartney and Ringo Starr ever got 100 million downloads on a video.
So actually, we had no idea that was happening. I've been posting for years just because we see a lot of really scared patients and we see a lot of special needs patients. So we have a lot of patients that are terrified of going to the dentist. So we started posting videos on our Facebook page, and we eventually started an Instagram page as well. But it was really just for our patients, just so that the parents would have something to show their kids at home and kind of get them acclimated a little bit to our office before even coming in. And that video actually was very, very pretty much surprising for us, because I posted it, I think it was on a Wednesday, and then I didn't really have any access to my social media for a few days. It was actually a Jewish holiday where we don't use any electronics. So right after, my sister called me and she's like, check your Facebook page, you have 10 million views. And I think that was 2 days after we posted it, 2 or 3 days. So I, beforehand it was a few hundred views, sometimes a few thousand views, and that one just went crazy. So.
And what year was that?
That was 2018, I think. I think it was May of 2018.
Yeah, because when I lectured in Israel for a week this year, in the beginning of the week, there wasn't a dental office I went into, because we're both from the same country, so they think we live on the same street. They go to Poland and they're like, "Oh, I know a dentist from America," And right. But I didn't meet a single dentist in Israel when when you say you're from the United States, and they called you Shimsky or Shim or.
So that was in residency. My assistant in residency actually couldn't pronounce my name, so she called me Shimsky, and that's what my Dental Town screen name is because of that.
Oh, because you need the back of your throat thing?
Yep.
But that is just so amazing that you did. By the way, can you send Kyle the video to add the video at the end of this YouTube so that the viewers can see what they're talking about? But
Absolutely.
Basically it's just adorable. So it's just this adorable little kid comes in and you blow his mind on a magic trick. And then a couple years later, he comes back for another appointment And you do it again to the same kid, right?
Yep. He actually now does magic tricks with me. So he comes and he shows me his own magic tricks.
Oh man, that is amazing. To be perfectly honest and frank, if I had to be a pediatric dentist, I'd quit. I mean, I worked with my dad for 10 years at Sony Drive-In, and he was very upset that I didn't go into it with him and all of his, he had 9, and all of his franchise friends, their sons went into it. And he told me, and he was right, he said, by the time you get out of Creighton and dental school, 8 years from now, you could have had 10 Sonics and been this much money and all this stuff. But I didn't want to make hamburgers and cheeseburgers my whole life. And my next door neighbor, Kenny Anderson, was the dentist, and that was so cool. But man, if the only choice was to be a pediatric dentist, I'd be a Sonic Drive-In manager right now, cooking hamburgers and fries. Where does this come from? Because if you think about it, when a kid cries on an airplane, well, of course it irritates all these people because that's why they're supposed to cry. That was an evolutionary behavior to say, hey, you left me behind the tree and I don't want to be eaten by a coyote. Come back and get me. So it's a very precision sound to irritate every nerve in your body so that this kid can live and someday reproduce and have offspring. Why did that sound not run you all the way off to prosthodontics?
So mostly because of my experience as a kid, I hated going to the dentist. Even now, if I smell an office that smelled like my dentist when I was a kid, I still get stressed out. So the good thing is that we don't have to suffer through that sound a lot because we don't have a lot of crying kids in our practice. So that's pretty much what started the whole evolution of how I do what I do. Just because I don't like listening to kids cry. For me, it's very stressful if we have a kid cry. So, we don't soundproof our rooms because we generally don't have a lot of crying kids in the office. And that's really my goal.
The legend of lasers in pediatric dentistry was the late Fred Margolis. And that's what he used to always talk about, how he didn't like the sound of that drill and he went to lasers. But you were saying smell. Well, what do you think's scaring the kids more? You just said smell. Is it sound too?
I think it's all of the above. And that's one of the difficulties of pediatric dentistry is trying to figure out what that one key trigger is for that patient on that day, because sometimes it's not the same the next day. So it's a little tough always figuring it out, but it's just really paying attention to those things that may be a trigger for any specific patient. I've had kids that are in terrible pain. You can do whatever you want as long as something doesn't taste bad. If something tastes bad, they're running out of the chair. So it's really not one specific thing. It's really any or all of those things.
So did you ever get to know Fred Margolis, or was he before your time?
Before my time, yeah.
Yeah. My gosh. I have a whole RIP podcast section. I mean, I've already got half a dozen of these old tankers that are gone now. But what do you think of Fred Margolis's idea from years ago to use hard tissue laser and not that sound? Some other people have come recently and said, well, go to an electric handpiece instead of that. I mean, the air turbine is got to be, it's the wind turbine.
Right. It's definitely a terrible sound. I do agree that if there's a way to avoid that sound, that's great. I don't use a hard tissue laser in my office just because in residency we had one that I didn't love. And I didn't feel like when I opened the practice that I really needed it.
And what one was that?
That was a water lace.
Water lace? And so it didn't work for you in your hands.
So, it did work, but I felt like it was a little slow, and I felt like whatever it did, I was able to do with a handpiece without any, major issues. So it didn't really.
And I'm not anybody's sponsor, nobody's advertising, but the Fred would say, I know I'm looking at Fred right now. He's so adorable. He would say, yeah, but he say, but you numb up the kid and then you leave the room for 10 minutes, then you come back and do this fast drill thing. But if you don't have to numb and you just walk in there and you do it, he still would have said it was faster. Do you agree with that? Or
so
not
most likely it's faster, although in my practice I can go a full day without numbing a kid as well. I do a lot even with handpieces with no numbing.
Wow.
So,
Wow.
Together with SDF, and I use a lot of glass ionomers. So we do as minimally invasive dentistry as you can do, I guess. I do a lot of Hall crowns as well. I don't know if you've heard of that technique.
Have I heard of it? It's like the most controversial thing. I posted a deal from Jeanette, and I felt sorry for her. I don't know how tough she is or if she's bulletproof or whatever, but
right.
Man, you post a Hall technique. you're going to get dentists. And granted, they're more my age than you and Jeanette's age. I mean, a bunch of old coggers are going to come out and say that you're crazy. So you walked into that door. So you just keep going with the whole technique.
I'll tell you my opinion. So, I mean, generally when I post things online.
First explain.
Sure. So the whole technique is basically based on a technique. I think it was in Scotland, somewhere in that area. It was Dr. Norna Hall. As far as I know, she was a general dentist, and she was in an area where there were a lot of kids and they were underserved. So there weren't a lot of options. And there are theories in dentistry and studies that show that if you seal decay, you can actually stop the progression of the decay. All the newer studies are also showing that, if you can stay away from the pulp, it's always better than going into the pulp. So basically, her idea was to seal out the decay. And the best way to do that we have in pediatric dentistry is to put a crown on the tooth. So she basically, stopped prepping. There was no numbing involved. It was just basically cement a crown on top of a tooth with a glass ionomer cement. And she had amazing success. I think there are newer studies that are showing about a 96% success rate, which is probably better than anything we do conventionally in dentistry. So for me, in my practice, we don't sedate. I don't own a papoose. We don't hold kids down. And anything that I can use that will help my patients is something that I'm willing to try. And I've done hundreds, probably thousands of Hall crowns now, and they work beautifully. So, for me, I don't feel like everybody has to do them. Everybody has their way of doing dentistry. I don't think if somebody doesn't do it, they're wrong. But I think that once people start doing them, they'll start questioning why they're not doing more of them.
But I have to challenge that. Because I know the emotional thing, because obviously everybody knows there's a difference between baby boomers and millennials. The old, fat, bald baby boomers are perfect, and the young, healthy kids. But it's this is the emotional thing that just makes them cry. I mean, I've seen it with tears in their eyes that you say this, it doesn't matter, do it your own way. But if you have to take a kid into the OR and the anesthesiologist puts him under and the kid doesn't wake up, he's dead. And we've had that problem here in Arizona. I mean, there was a Yuma practice, lost a patient. Gosh darn, same practice, lost one like 3 years later. And it's tough because I don't know how many funerals you've gone to, but when you go to an old grandpa funeral, no one even cries. Everybody's like, he's a good man, good life, live long. Grandma dies, there's some tears. Baby dies, holy crap, the whole family falls apart. I mean, I was at a funeral of a dentist for a 6-year-old, and people were crying so hard they had to stammer their foot. And it was the only time I've seen the foot stammering at an event like that, which is a rare behavior. So they argue that, okay, your technique of taking him in and putting him under, you do it enough times, someone's going to die. Whereas you're not doing that. So if that kid would have seen you and not the other kid, he wouldn't be dead.
So that's why
I think explodes the emotional compact of this.
Right. I mean, I feel like the problem with like me saying that everybody has to do with that is that officially it's not standard of care at this time. I was actually in touch with I think she's a hygienist in New Zealand, and she said for them it is standard of care to do the whole technique instead of what was considered conventional. So I do think that at some point we're going to get to that point, and I do hope that's the case, because the trend in pediatric dentistry a lot is moving towards sedation sort of on one end and less invasive on the other end. So I'm hoping that it moves more towards the less invasive. I don't do sedation in my office, and I haven't been to the OR in over 3 years now. So, it does work. So that's why I try to post cases online for people to learn from it and see what it can do and what we can do without going to the OR. But again, I think changing things from what you're used to, when I was in dental school, if you left decay behind in anything, you were going to fail. And now we're leaving decay behind all the time, and it's working beautifully. So it's just sort of a shift of what we're used to versus, what we're hoping to get to.
The thing that really blew my mind, I'm trying to think of the other dentist in Scotland that hypnotized. What's a dentist in Scotland that hypnotizes? I know his name, I know him. But anyway, he really was the first one that got through my head, where he says, the problem with putting kids to sleep or adults is you're not treating the fear. You're just knocking them out. And he said what he liked with the hypnotizing is he was treating the fear. And he says that, you Americans, knock them out, put them to sleep, and they wake up, they don't have a dental problem, but they still have the same mind issue.
Absolutely.
And by the time he did a couple of sessions, he fixed the mind issue, and then he fixed the tooth. Is that kind of how you see it?
That is how I see it as well. I mean, we actually are happy to say that in our practice, we have more kids crying that they have to leave versus crying that they have to come. So that's really our goal, is to get them used to it and kind of change the mindset from, going to the dentist being a scary thing as something that, parents come in and tell me that their kid's been waiting for months so they can finally come back to the dentist.
It was Mike Gow. Mike, if you're listening to this, Kyle, can you edit the part out where I can't even remember Mike Gow's name? No, you don't have to. But yeah, Mike Gow. He was episode 463, Dental Hypnosis with Mike Gow. He was from Scotland. And my God, he has videos and training, and I went to his 2-day course, and he can take the most scared, unbelievably, freaked out patients. But he works on that, and through a couple classes and sessions of dental hypnosis, they're fine dental patients.
Right. I never really kind of thought about it in that way, and not addressing the fear when you sedate them, but it is definitely a great point.
Yeah, and the other thing is like I know in my family, I know if any of the grandmas or grandpas died, it'd be a bad day or a bad week. But if one of the 6 grandkids died, I mean, you just lost a year of depression. I mean, it's just so that one rare. How rare is it that a kid in America goes to the OR and doesn't come out?
So I mean, it's in millions. For a healthy kid, it's really a very safe situation. But what I generally tell parents that are discussing OR versus not OR, if I think that kid should stay out of the OR, is that even if it's 1 in millions, for that one kid, it doesn't really make a difference anymore. So,
and plus it depends on which kid it is.
Well.
if you got no. But how many times a year do you think it happens in the United States?
I mean, you hear about it probably twice, 2 to 3 times a year.
Yeah.
Which, any case is too much for me. I always do the risk benefit analysis, and for me, there isn't much of a risk of any of my patients dying from what's going on in their mouth versus going under general anesthesia. I think, yeah.
No. Another weird thing, I don't know. Well, obviously it's because I live in Arizona, is why it's on Arizona. But we had another issue where it wasn't even a pediatric dentist, but the in my office, the hygienist can numb. So he was doing 4 quadrants of and the hygienist went in and numbed.
Oh wow.
He didn't know.
Overdosed.
So then he went in there and numbed. And then that was it.
That's it.
And then that wasn't even the worst part of the whole deal. I mean, that was the worst part for the family and the kid. But then he tried to erase and they tried to alter the deal. And kids, let me just tell you one thing, man. It's I guarantee you, your crime is always worse. The lie is worse than the crime. It's like Bill Clinton. When Bill Clinton got caught with Monica, if he just would have walked out there and said, "Hey, why don't you be married to Hillary for 30 years?" Everybody would have said, whoa, and they would have dropped it, And every man would have got it. They said, oh, yeah, sorry I brought it up. But he lied, and then he got caught. And the same thing with dentists. I've seen out here where, let's say you get addicted to hydrocodone, and you're ordering 500 bottles from Shine, and the DEA knocks on your door, and you lie, it's go to jail, lose your license, you're in a cage. If you raise your hand and say I just can't get off of this, don't worry, we'll take care of you. We got a whole program. So I mean, when they knock on your door, you don't say I did not have a relationship with that woman, Miss Lewinsky. I mean, just the lie is always worse than the crime. You should all know that by now. So when you're busted, you're busted. The next worst idea is start lying about it. But yeah, it's a very emotional topic, isn't it?
Yeah, absolutely. I mean, we have patients that have been told by 3 or 4 other dentists that they had to be sedated, and the parents are just looking elsewhere. So, I mean, parents are realizing this, and they're seeing the news stories. So, it is changing sort of their views in terms of going into sedation or not. There are studies that actually show that families these days lean more towards sedation versus older, old time kind of pediatric behavior managements. But, parents are
And let me tell you another thing, way to look at this risk. So in dentistry, there's only 3 publicly traded dental companies, and none of them are in America. America tried it with Orthodontic Centers of America in the 80s on the NYSE. That was a disaster. There was a dozen on NASDAQ. Wall Street won't touch them again in America. Not one of these DSOs could go public. And I've talked to a lot of Wall Street MBAs, things like that. But there are 3 There's two of them in Australia. One 300 dentists, Pacific Smile. Then there's one in Singapore, Q&M. 3 for 3 in order to go public. The investment people said there will be no sedation on anyone under 18 or over 65. And I got to see the data on that decision. And the decision is, I mean, it's not a problem between 18 and 65. It's a problem under 18. And then when you get to like 6 and under, the problem scales. And then over 65, it's the same thing. You know, it starts scaling it over 75, 85. But 18 to 65 is the only permission they were given on the markets for them to go public. They weren't going to have something go public with that much risk. So, and they talk about lung function on pediatric jail, that it's a viral.
Yeah, it's very, I mean, kids can decompensate very quickly, and you're working with a much smaller kid. A lot of the sedation emergencies and fatalities have also happened in offices versus in hospitals, where you don't have the support staff to help if there is an emergency.
If you believe in Darwin, the number one goal of a species is survive long enough to reproduce and have offspring. I mean, you see it with all the animal kingdom that the kid comes first, right? I mean, it's just kid. Like take the example, like in dentistry, like people will want to go to Spear and Coyce and Pankey and Ross Nash to learn full mouth rehab on Grandpa. But the mom's going to, say, well, Grandpa's almost dead. I'm going to get my daughter braces. There's 10,800 orthodontists, and they're, 80% of their mix is kids. Mom is going to buy ortho on her daughter before she gets veneers for herself. And if Grandpa asks for veneers, she'd just take him to the crematory and put him down that day just for asking. And so it's so emotional, and especially for me. I mean, I got 6 grandchildren, and 7 of them can do no wrong. And so when it's always making the newspapers, I mean, like a dentist is in the newspaper because they, put his hand over his mouth, or patient control. I mean, it's always in the news because it's so emotional. They would never run that article if that guy had done that to Grandpa. Right. She put his hand over his liver spot. I mean, his eye or his mouth. I mean, it's a baby, and it just picks you off emotionally. What do you think about all these stories in the last 10 years on Dental Town about mom upset about these techniques trying to avoid? These dentists are trying not to take him to the OR. So sometimes they're like, I am going to put you in a papoose, or I am going to put my hand over your mouth, or I am going to be Coach Vince Lombardi or something like that. And then it makes the newspaper, and that's got to be anti-marketing for your practice. I mean, so what do you think about all these events?
I think parenting has changed a lot also. So it changes, like when I was a kid, if I wasn't behaving at the dentist, my parents were going to make sure I was behaving at the dentist. And if the dentist was the mean guy, that was perfectly fine. These days, I have 6 kids.
Are you my brother? Do we have the same mom?
Yeah. So, I mean, things have definitely changed. And I think a lot of those techniques that were taught, like the hand over mouth, is not really taught anymore. Papoose is really only supposed to be used, worst case scenario, not for routine treatments. So that's changing a little bit in pediatric dentistry in general. But I think a part of the problem is also just managing parents' expectations. It's not just, there's a kid here. We have 2 patients at the same time. You have the patient and you have the parents also. So I think that if things are discussed beforehand, then it, becomes a discussion, and you can kind of work on a plan together with the parent, versus if the dentist just decides to do these things that may be shocking to a parent who's more permissive with their kid. There are patients that the parents come in and say, oh, we don't say no to our child at all. So whether I believe in that or not, it's not my job to parent their child. So we have to kind of get on the same page to what their expectation is and what they're able to accept and not. So, I mean, personally, because I don't like those techniques, it's easier for me to avoid them, because I don't like crying kids. I don't like being the tough pediatric dentist. And I found the ways that, for me at least, work to avoid that and not do sedation. So, that's kind of what pushed me to learn as much as I can with all my little tricks that I do in my office and the different kind of clinical techniques that we use. I do feel like there is a way to put that all together and avoid sort of all the bad parts.
Man, it was a walk through history here. You talk about when I was in school, every one of my friends, if you went home and told your dad that Sister Mary Aloysia had to get the ping pong paddle and smack your butt twice, he would do it 20 more times. I mean, every one of my friends in school, if you got in trouble, no one talked about that you got spanked or paddled. It was just the fear of God that your dad would find out, because whatever the crime was, he would do it tenfold. And now it's like, you touched my perfect little Karen. I mean, Karen, it's really, times have changed. Yeah, totally different world, isn't it, than back then?
Absolutely.
Who would have thought in dental school that pediatric dentistry would be the controversial profession? I mean, I can remember when I first learned about pediatric dentists, I didn't even get it. I'm saying, so they have a specialty just for small humans? I mean, what's the difference in a big one and small one? But like silver diamine fluoride, there's people, there are people that they would go to punches if they were in person over this stuff, leaving in decay with the whole crown. Oh my God. When I published that article on Dental Town, I got 3 different, I forwarded them to Jeanette, and they were just like, this is, they couldn't say anything nice about it because you're leaving decay. And now silver diamine fluoride, it's the same thing. So some of these guys, and I'll tell you the truth, some of these people, some of these older dentists look at whole techniques, and silver diamine fluoride is substandard care. It's just so talk silver diamine fluoride. And congratulations on being in the New York Times. I kid you not.
Thank you.
I 100 million views for a magic trick. It featured on NBC Nightly News and the Kelly Clarkson show. Gosh, I can't. I have to admit, I've heard of the name Kelly Clarkson. Was that some girl that was on like the Song Is Right, or the song?
Yeah, I think she won American Idol, possibly the first one, and then she's now a singer, and now she just started her own talk show.
Okay, I can't say I saw any of those shows, but 100 million views, featured on NBC Nightly News, the Kelly Clarkson show. That is just amazing. But the New York Times, that's a tall building filled with journalists, and they found you and Jeanette McClain.
Yeah, they actually came to my office, and I did a Facebook Live interview with the reporter also about SDF at the same time.
Well, congratulations on that, because I'm sure they vetted the smartest people they could find.
Appreciate it.
Yeah,
Thank you.
If they ever called me, it'd probably be a wrong number or something like that. Or
that's what I thought when they called me the first time.
So were you? First of all, were you scared? Usually your lawyer would say, "Hey, the New York Times is on line 3, so can we just bury the phone under cement?"
Right. So I really thought that was a joke initially. I was like, nobody's calling me from or emailing me from the New York Times. So I actually Googled the reporter's name to find out that she was really a reporter. And then, the reason that I agreed to it is because I felt like it was good to get that information out there, because I do like that the trend in dentistry may be moving more, minimally invasive. And I think one of the problems that, more seasoned dentists have with these techniques is that they get really, really, now with social media, everybody hears everything really quickly. When I was in dental school, if there was a new technique, I could see it in Dental Town, but not much else. Nobody's sending me a quick text, look at this. Now everything gets everywhere. And what happened is that, just like with everything that we do in dentistry, your case selection is really important. And, people were just putting SDF everywhere, whether or not it was indicated, and, lots of failures. But if it's used correctly, I do feel like it really works well. And I have thousands of cases, to show now. But again, I do feel like it's a big shift, because again, we are leaving decay and we're treating it medically versus surgically. So, with Hall crowns, I can show x-rays of Hall crowns years after I did it. It'll look way better than the ones that I did conventionally before I started doing Hall crowns. And they really work really well. So for me, I try not to sort of say, hey, this is what I was taught and this is what I have to do. It's more like, this is what I'm learning now, and which, seems to be working. And I try to pick my cases slowly. And that's sort of how I figured out what works for me and, when it works and when it doesn't work.
You have 2,000 posts on Dental Town, and out of the 10 specialties, endo, there was an endodontist debate from a guy, an endodontist in New York, who ran off most of the endodontists. I agree with that. But pediatric dentistry, of all the specialties, it's the richest forum. I tell pediatric dentists, I said, if I was an orthodontist, I'd go to Ortho Town, or Facebook groups or whatever stuff.
Right.
But man, the pediatric dentist on Dental Town, you guys have been intense. I mean, you've been a member since 2004, and it's an intense forum. I mean, it's all things pediatric dentistry.
Yep.
And you're a big part of that. Thank you so much for that.
Oh, thank you. I appreciate it. I've learned a lot from the dentists there as well. It's really amazing. I actually learned about Dental Town from the pediatric dentist that I shadowed before I even started dental school. He was very into it. That was Dr. Ellie Racklin, and he still follows all these things, and we keep in touch. But that's really what sort of opened my eyes to Dental Town. It was just great being able to discuss things with dentists from all over the place, and get a lot of information from them, learn from them, teach them new, little tricks and tips that may be helpful for them as well.
I call it Dentistry Uncensored because I don't want to talk about anything that anybody agrees on, but let's talk about the ugly side of this debate. A lot of people are saying, well, if I can bill out a pulpotomy and a chrome steel crown $1 each, say I get $1 for a pulpotomy, $1 chrome steel crown, that on silver diamine fluoride, they're giving me a quarter or 50 cents. And a lot of people say, I have this big office, I have this deal. I would go broke if I started doing this. So what is the difference in revenue billed for like a whole technique versus a pulpotomy, chrome steel crown, or silver diamine fluoride? Approximately how much less reimbursement are you going to get for these conservative techniques?
So probably 50% less, or maybe even less. I tell people I hope a good dentist, but a terrible businessman. So I don't focus a lot on the business part of it. For me, I've made back probably whatever I lost from doing less work, just on the fact that we're so busy, just because we get a lot of free advertising because of it. So, my goal is really to do what's best for my patient. And I have had discussions with other pediatric dentists who told me the same thing. They're like, listen, you're doing whole crowns, but, I'm taking insurances. And if I'm doing a whole crown, I'm not getting paid for the pulp. So that's just, how I do it. And again, I don't really agree with that, because I do feel like, if what I'm doing is less money and less invasive, but it works and it's best for the patient, that's really my job as a dentist to do that, whether it's the best, financially or not. So,
I agree. Sort of my take I always tell my boys, I said, you know what, go to a doctor who's successful enough he doesn't have to cut any corners, because, I've always had a successful I never had to think like that because I was never in that deal. But there are some obvious macroeconomic indicators that show that's not the case. The obvious one is Röntgen with radiology. He came out with the X-ray, and then a year later, it was Thomas Edison started working on it, but then his assistant got hand cancer and had to have his arms cut off, so he quit, and blah, blah, blah. Anyway, it went on for a long time, and dentists didn't even look at it. And then the first dental insurance came out. It was the Longshoremen's Club up in Oregon, Washington, New York, which later became Delta. And they covered x-rays at 100%. Oh, my God, the x-ray machine. It was like domino effect. So out of nowhere, all the dentists now need an x-ray machine, when the last 50 years, all the way to Röntgen, nobody needed it. So incentives matter. And if incentives don't matter, then we need to throw away economics. We just need to go over to the Department of Economics and say, you guys are a bunch of unicorns and mermaids, and we're done, So do you think that insurance companies should maybe reevaluate the reimbursement of some of these conservative things, because that might be tipping the edge for a lot of people?
I definitely do think so, although just with my experience with insurance companies, they're usually not as worried about the dentist or the patients, compared to what they're worried about themselves. So I guess it has to be worth it for them. I definitely do think that the less invasive techniques are billed out less. And, when I was speaking to my wife about it, I told her, I work double as long, double as hard to do half the billing. But at the same time, I feel like that's what I should be doing. So I definitely think it should be addressed. I don't know if it's ever going to change. But at the same time, as my practice has evolved with these less invasive techniques, even though I'm doing less work, we're spending less time also. I can do 2 crowns on a patient in 5 minutes, versus if I had to numb them and put a rubber dam on and prep it conventionally and do a pulp, if I was going to do that, that's going to take me a half hour to 40 minutes. So I can do those 2 crowns in 5 minutes, and that patient is done and the room's clean, and then we can see the next patient. So I don't think it's given me a major cut in what I'm making. I probably don't make as much as other pediatric dentists that are doing a lot more sedation and full mouth pulps and crowns. But I'm making enough to live as happily as I want to. So for me, it's fine.
Yeah. You also are You are a noted expert on healthtap.com. Tell them what healthtap.com is and why are you a noted expert on healthtap.com?
So I've actually slowed down a little with it just because I've been so busy, but it was a website started, really a medical website, just to help people who didn't have access to care be able to ask questions online and have medical professionals kind of guide them. So it wasn't really a diagnosis or a treatment recommendation. It was sort of like what direction you can go. You know, if a patient says, this is what's happening with my child's tooth, what should I do? You know, you can give them sort of an idea. Do you need to see a dentist right now? Do you not need to see a dentist? This is something that you could look into, you know, and maybe something that can be helping, you know, just for the time being until you see a dentist. So when they opened, I actually spent a lot more time answering a lot of questions. Recently, I haven't for a while, but that was pretty much the goal of that website, to kind of get a lot of different medical professionals together in the same place and be able to help, you know, just people at home get answers where they wouldn't be able to get them otherwise.
Yeah, I hope I'm not throwing any of your friends under a bus, because I know your pediatric community is a really tight community and all that kind of stuff. But I'm just going after, these are big names. Richard Baxter. He put an online CE course. That's another one that's real controversial. Can
Tongue
you,
ties.
what's that?
Tongue ties?
Yeah, and in fact, I felt so bad. I had to bother Jeanette McLean one time on the weekend because my own friend, she just had a baby and she was crying, and she called me because after, I guess now when you have a baby, I guess for the last 1 million years, you just started nursing on your mom. But now after 1 million years since mitochondrial Eve and 120 billion humans have lived and died, a person's going to come in and help you learn how to breastfeed, and drop the bomb that she thought she needed to have, you know, this tongue thigh thing. And she was crying, and they called me because I'm a dentist. I'm like, yeah, I'm a dentist, but I've never nursed a child, and I'm not a pediatric dentist. I don't even, you know, so tongue-tied.
So I'll tell you my take on it. I'm definitely not an expert. I actually went to the first, you know, symposium with Dr. Baxter at the same time. We were sitting at the same table for part of it. I feel like my opinion is actually that within at least the dental world, that sometimes, and I don't think this is the case with him, but I do think that in some cases, when somebody becomes an expert in something, you know, it's always done. Like, for instance, I've sent patients for evaluations to expert in tongue-tied, and I don't remember ever having one come back, you know, being told, oh, you don't need it. It's just pretty much done. So my opinion is that there's people on one extreme where everything that is tied, including buccal frenums and tongues and lips and everything, have to be released. And I've gone to lectures that said, if not, the kid's going to have, you know, neck issues and back issues and behavior issues. And then, you know, when I was in dental school, it wasn't discussed at all. So I feel like there's a really, really wide spectrum in there, and I try to be in the middle. I do feel like there are times where it's definitely indicated, but I don't feel like I know enough to tell you if it's being overtreated or undertreated. In some South American countries, I think it's mandated at birth to have a lactation consultant take a look at the tongue. There are theories that possibly the use of folic acid now more with pregnant women makes it more likely that kids are having these things that really embryonically should kind of go away by themselves, and they're not going away. So I definitely think that it is something that probably should be taught more in dental schools, but there's no real consensus even within the sort of tongue-tie world. There's different opinions of how it should be done, how aggressive it should be done, if it should be done, you know, how to classify it. So my take on it is that I don't know enough to be able to tell you sort of a real opinion, other than I do think it is necessary at times. And we do them in our office. We don't advertise it at all. It's really just word of mouth. But most of the time, parents who have been having a really hard time and are in a lot of pain, my wife actually works with me, and she's also a labor and delivery nurse. So she helps the moms.
Cohen is your wife?
No, she's my associate, but my wife works in the front desk. She's of runs the practice, but she's also a labor and delivery nurse. So after I do the releases, she helps the moms with the breastfeeding. And most moms say that there's an immediate change in how it feels in terms of the pain and how well the baby's eating. So it does seem like it does work well. It is a very good point that you brought up.
If you get rid of the tongue tie, your wife's, they're saying it's a lot easier and better?
A lot of parents say that it is a lot better. Now, there are cases where it's not better at all. And I've had cases where I sent parents home and I said, listen, there's plenty of mobility of this tongue. Maybe your child is not latching well, but it's not because of their tongue. And then, there are kids that take a little while longer to learn how to nurse. So it's definitely a possibility that it's just something that they have to learn. In terms of, why now suddenly it became this big thing, I don't know if it's because anatomy has changed in any way. Who knows? Or if people are just, learning about it and saying, hey, you know what? I nursed 3 kids and they barely nursed and I had to change the bottle. But with my 4th kid, I heard about tongue tie and now we're released it. And look, my kid is nursing so much better. So it could be, a little of everything.
I think it's a lot of it is fad because, like, okay, so there were 7 kids in my mom's family, right? The first 3, we were born, Mary Kay, G. Marie, and me were born when that the milk you buy in the store was better and fortified with vitamins and minerals, and who would nurse naturally. And if you ever got a sick or cold, they just immediately took out your tonsils and adenoids. Right. So the first 3 babies, no breastfeed, all lost their tonsils and adenoids. And then the next 4 kids all breastfed and have their tonsils and adenoids. So when I say something is a fad, I mean, hell, I lived through a fad and I lost my tonsils and adenoids and didn't get to breastfeed, which is bad because that first 24 hours is the colostrum where you get all the antibodies and all that stuff. Yep. And at the time, the marketing and advertising people convinced my mother that it was better to buy something out of a box or a package. So, so when people just blindly follow doctors and fads, they're not a student of history. I mean, just a cursory Google search of fads in medicine would show up all kinds of things. I want to talk about another thing, which I thought was crazy from the beginning, but it's still a thing. People do sealants, and when I look at the research, I mean, it's like hard to find research that shows that even half of them last a year, and the body of the research is none of them last 2 years. And how much harder would it be to take just a little drill and knock out the grooves and do a occlusal composite? And so you could call it a preventive resin restoration, but I'm old school, so I had those air abrasion deals. And I've never had a human at any age where when I turned on that air abrasion on those pits and fissures, I was in yellow dentin every time. So I don't even know if you could technically call it a preventive resin restoration because I had no drill in the tooth. I just blew out the junk, and I was down into dentin on every molar, premolar, any age. In fact, the funniest thing was that when I first opened up, the head of Delta Dental of Arizona was Ed Judd, and I love the guy. He's a great guy. And he asked me, what are you doing all these sealants for on adult teeth? And that was his problem. And I said, well, come over to my office. So he came over to my office, and I was just like, oh, my God. Please have 1 virgin occlusal surface left. And he had 2. So I sat him in the chair. I felt like I won the lottery. I showed him with my intro camera, the 2 fissures. I got out my creative micro air abrasion aluminum oxide, and I sprayed it out. I showed him the size of the holes. Then I did the acid etch bonding composites. When I was done, he jumped out, took out the napkin, high-fived me, and said, Howie, that was cooler than shit. And I just thought to myself, well, why would you take that pit and fissure filled with bacteria, junk, Oreo cookie, Dorito, and acid etch and apply a sealant on gunk? And then you go into a lot of offices and you look at the charts and, okay, we did a recall cleaning on her, but we got to move her over to this room and do a sealant repair chip. And it's like, dude, you have 6 sealant repair chips today. I mean, what? So tell me I can't think of anything good with sealant. So tell me your thoughts.
So a few thoughts. Number 1 is I don't do resin sealants at all. Generally, I only use glass ionomer for sealants. So the reason that in theory a sealant would work is the same theory as a Hall crown, is that there is something starting there. If the sealant is done ideally, which is the key word, then it should seal it and then stop the progression of decay. I don't feel like most sealants are probably done ideally. Most of them, you're not putting a rubber dam on. So if you're doing resin and you're not keeping it isolated, most likely eventually you're going to be doing a filling on that tooth. So I don't like resin sealants. I feel like it is much harder to do them well because they should be isolated like you're doing a composite on the tooth. So I use glass ionomer sealants. There are studies that show equal cavity prevention. But my thought process on it is that when teeth first erupt into the mouth, they're not fully calcified. So they're sort of weaker teeth, which is why they're more susceptible to getting decay. If you then, bond a resin sealant over that tooth, you're now kind of blocking off part of that tooth from being able to absorb minerals from the saliva. Once that sealant fails, if the bond breaks down over time, now you have sort of the same weak tooth that you did before, now without the protection, and then you get these huge cavities under it. With a glass ionomer, it actually releases fluoride into the tooth, so that when you're sealing with it, you're actually maturing the tooth, maybe in theory, even faster. And that's why I find like it's much more protective. So I don't like resin sealants, but in general, I don't love resin. So I like glass ionomer.
That's funny when you said rubber dam. I had my mind blown yesterday. The CDC. I mean, here I am. I've signed up for the CDC Morbidity Mortality Weekly Report because it was free. I signed up for that in '87. Jack Dillenberg told me, and I get this deal, and it's talking about the dental dam, and it's with STDs, and it's like, did you say dental dam? Have you ever heard of this?
No.
Sure enough, it's one of the protections against STDs. You probably wouldn't have come on the show if you knew I was going to talk about this, and I won't. But pick your protection: condom, gloves, finger caught condom, dental dam.
Wonderful.
And then I thought, okay, I'm just gonna let this one die. And sure enough, it wasn't even 4 or 5 hours, and 2 other dentists emailed me that said, "Did you see this? A dental dam prevents STDs." And I said, I don't even know if I'm going to go there. So when you say glass ionomer, I mean, let's just talk facts. If you're looking at GC America and you're looking at glass ionomer sales, it's all sold in Asia. I mean, it's mostly Japan,
Absolutely.
New Zealand, Australia.
Yep.
And if you want to even talk about glass ionomers in the United States, it's the country that doesn't use glass ionomer. So
Right.
my next question is, are you Japanese, New Zealander, or Australian down under?
I'm actually Persian Israeli American, so none of the above, but I'm a big nerd and I like reading things, and I actually learned more about glass ionomers actually on Dental Town. When I was in dental school, we barely used it, we barely discussed it. In residency, I got a little more access to it, and my residency was pretty open-minded, and if I wanted to try things, they would let me. And I realized that I pretty much never got recurrent decay. So I use glass ionomer all day, every day.
Which brand of glass ionomer?
So I like GC America.
GC America,
So
but
that's the Fujis.
So you like what, Fuji 7, Fuji 9, and that's a problem I want to say to Fuji right now, because I told them this when I was in Tokyo, that the problem with GC is they call their products different things in different countries.
Right.
It's like, have you heard of the internet? It goes back to AOL.com, but they have a serious branding problem, and other countries have just done it. Well, remember 3M? They used to have Vitromir, and they used to have all these different. And then one day they dropped all those things. And they went to they dropped Vitromir, and they all that stuff. But that Fuji needs to do that. But out here you're buying Fuji 9. Is that what you're saying?
I have all of them. So I have Fuji 2, Fuji 9. GC America actually has a lot of versions of Fuji 9 now. There's probably 4 or 5 versions. But I use mostly Fuji 9 Extra, which they now call Equia. And they have a new reinforced version of that called Equia Forte.
And by the way, a lot of people think that GC moved to Switzerland, but it's still all there in Tokyo. They moved to Switzerland for taxes. It's like so they go there
Business
for
decision.
their
Right.
yeah. It's an international deal, and I know if you're poor, you love high taxes, and if you actually produce, you don't like taxes. So it's just a deal. But so you would so. Let me hear. So you believe in sealants if it's with Fuji 9 glass ionomer? Sealants?
So the official sealant from sort of the Fuji glass ionomer family is called Triage. I use Fuji 9, which is really a restorative material, just because glass ionomers historically are known for wearing away faster, and Fuji 9 is a more filled, more highly filled material. So that's why, and it also releases a lot of fluoride.
So Fuji recommends Triage for sealants, but you use Fuji 9.
9, yes.
Yeah. And my gosh, I remember the first time I lectured in Australia, it was like they kept telling me, why do you use a direct composite? Why don't you do a sandwich? And I'm like, did you say sandwich? And what they meant by that is they lay a layer of Fuji on the floor, and then they put on the composite. And
Me too.
So
that's
what you do? That's what you do? Now, do you call it a sandwich?
I mean, it's known as the sandwich technique. There's the open sandwich and a closed sandwich. For instance, if you do a class 2 box and you fill the box with a glass anamer and then put composite on top, it's open because the glass anamer is actually open to the oral environment, versus if it's like a class 1 where it's just buried under the composite. That's a closed sandwich.
That's a closed sandwich. I'm so old, I still eat Subway sandwiches. And so then, what do you think of the technique, the difference between a sealant, a preventive restoration, the sealant fissure burrs, lasers, air abrasion? Are you just laying Fuji 9 on these pits and fissures, or do you do something to debride all that out?
I do air abrasion first.
With what?
First week, I don't even know what company I have.
Is it
I
Creative?
have
Creative Mach 5?
Not sure. I don't think so.
Does my assistant, I mean, there's some things I can do where I get punched. Like if I say that's a no-brainer, she thinks it's an insult. She thinks I just said you don't have a brain. So if I say, oh, come on, that's a no-brainer, that's like when your older sister, you say, hey, would you like a Hertz donut? And you said, sure. And then she punched you. Hurts, don't it? But she hates the air abrasion because it's just the biggest mess. It's just, it's everywhere. Does your assistant complain about that?
She hasn't so far.
Yeah, because I love it.
She may.
And I like that little cheap Danville one, that little Danville micro blaster. I mean, what does that cost? What would something like that cost?
Probably under $1,000, but I don't know. I know U3D, I think, now has one also.
Yeah, but I think it's I think the little cheapo one is almost half as good as the several $1,000 one.
Probably.
Or what are you using little cheap Denmat or the little?
I'm using a cheap. Yeah, it's not a fancy.
Yeah. And that's like the second hardest substance known to man. It's like diamonds and then aluminum oxide, right? So you're spraying it out with the air abrasion and then doing what? Go through your technique.
So these days, it's a discussion that me and Jeanette have had for a while about doing the glass anamer conditioner first, which is a weak acid. It's a polyacrylic acid. It really depends on who you ask in the glass anamer world if you need to do it or not. Officially, it's supposed to increase bond strength and help sort of the mineral exchange for the tooth, but typically I don't use it. So once I air abrade it, I just wash it out. You don't want to keep it completely dry, so you keep it a little damp. Glass anamer actually uses moisture to set. So if it's too dry, it actually won't work and it won't bond well. And then I just dispense some onto the tooth. I use a wet Q-tip to just smooth it into the grooves, get rid of the excess. And officially that can be it if you want, but I put a resin seal over it just to allow the material to set without getting too much moisture.
So let's we talked about Richard Baxter. We talked about Jeanette McLean. So let's go to the other famous pediatric dentist on Dental Town, Jared Johnson. He did a course, The Blunderbuss Apex, A Search for the Smoking Gun.
He's a great guy.
Yeah, he's amazing, from Iowa. What do you think of that course and that whole discussion?
So I love his stuff.
The Blunderbuss Apex. Explain what that is.
So basically, it's when the tooth is not fully developed yet. The apex of the root is not closed, so it's sort of shaped like that old gun, the blunderbuss. So it's sort of sticking out at the end, and you don't really have an apical stop where you can fill it. Jared's actually one of the few pediatric dentists, and maybe the only one that I know that does full endo on patients. I think his father's an endodontist, but he does full endo, which is really rare to find in the pediatric world. So again, I mean, it is from the things that I've seen that he's posted and just from speaking to him, he also is less invasive with these things. When I was in dental school, if decay was into the pulp, you just went into the pulp, you got rid of that pulp, and you did a root canal. These days, there are a lot of options that you can kind of avoid doing that. And things, teeth that have a blunderbuss apex are always going to be sort of at risk because your crown root ratio is never going to be great because that apex is never going to be, closed unless you do techniques that can kind of continue the tooth growth. So I'm not sure specific to, what kind of cases you're talking about, but there is the treatment called apexogenesis where you can use materials to try to get that tooth to actually form a real apex.
I'm laughing because I remember helping him and Hogo when that course came out and all that stuff like that. And I remember thinking of the title, like, I mean, it didn't register blunderbuss apex colon a search for the smoking gun that there was a blunderbuss
Best
gun.
gun. Yep.
You just educated me on that one right now. I had no idea.
It's one of those olden day guns where the barrel kind of ends sort of flaring apart.
Wow. Wow, I missed that completely. Are you and Jared the only two people that are aware of the that blunderbuss is a thing? Did you already know that ahead of time?
Yeah, I'm a nerd. I know a lot of useless information. So
wow, I think that's really cool. I had no idea, but now it all makes sense. But he's from Iowa, so I expect. I mean, there's more guns than people in like Kansas, Iowa, Nebraska. I don't know where you're in New Jersey.
Yeah.
What do you think? There's more people or guns in New Jersey?
Legal or not legal? That's the question. Legal guns, probably not. Illegal guns, maybe. There's a lot of crime here.
So then the other one, pediatric dentistry, pulp therapy, and stainless steel crown. I wish you'd go through your technique on that because a lot of the questions on general dentists talking about pulp therapy. Some like to stop the bleeding with astringent. Some people. What's your are you not really doing any of these?
So I don't do a lot of pulpotomies anymore, but I still do some. And generally, until more recently, I was using formicresol, which is really the gold standard still, but it is a carcinogen, so we try to avoid that as much as possible. Now, studies are showing that MTA pulpotomies are as effective and not as poisonous. So it depends really on what the pulp looks like. Ideally, you really can just use, a cotton pellet just to stop the bleeding just with pressure. A lot of people use sodium hypochlorite. Some people use Paradex. So you just want to use something that's going to disinfect and try to stop the bleeding. And then MTA is great. So with that, generally what I do is we just stop the bleeding with either sodium hypochlorite or chlorhexidine, and then pack MTA on top of that.
So MTA, that might have flown over the heads of some of the kids in dental kindergarten. Mineral trioxide aggregate. That was invented by, I never met him in person, Mahmoud Torbinajad. Did you ever meet him?
Nope.
So tell him what that is and what you meant by that MTA.
It's more of like a bioactive type of material. I'm not sure the exact science behind it, but it seems to be, from all the studies, the most kind material to the pulp. So it can sit on top of pulp without damaging it, and it actually, in many cases, stimulates the tooth to lay down a layer of reparative dentin. So in many cases, even with permanent teeth, at times, if we're cleaning out decay and we get into the pulp, instead of now doing a root canal, we can cap that pulp with MTA, and oftentimes the tooth will stay vital.
I want to go back to some Dentistry Uncensored stuff, if that's okay. What I'm trying to do is get you kicked off of Dental Town and lose all your friends and piss everyone off. But we talked about incentives matter. I mean, I don't care what anybody says. Dentistry was not extra interested in radiology until Delta covered it, and by the way, and I'm not too impressed by CBCT, mainly because I can't read any of mine. I mean, I've been in my dental office with my associate and a visiting dentist and a friend for lunch, and we're all looking at it, and we're like, well, what is that?
What are you looking at?
Guys, like, I have no idea. I always just say it's a galaxy. I say it's Andromeda, but I grew up where, it was a pano. I think the coolest radiology invention of all time was whoever figured out how to put the R on one side and the L on the other. I thought that was dentistry's finest moment in radiology. But so we talked about incentives matter. So now let's talk about turf wars, orthodontists, and pediatric dentists. I have lived through some of these turf wars in my own backyard of the pediatric dentist doing a space maintainer. And then by the time you get to the orthodontist, I guess that affected the benefits, or maybe they had like a once-in-a-lifetime benefit deal and they lost that. And there are pediatric dentists in Tempe who are on non-speaking terms with orthodontist in the same city about this issue. So that's about as so you know what I'm talking about, right?
Yeah. So I mean, I feel like communication is really important. It really depends on the orthodontist and the pediatric dentist. Not every pediatric dentist is even comfortable doing any ortho type of appliances. Most of the orthodontists that I work with would much rather me do the space maintainers. And as far as I know, most of those times they're not covered under ortho benefits. Those are usually covered under dental benefits.
Okay, so that's a space maintainer. So for a missing single tooth.
Right.
So what's the criteria? Because answer that question, because the kids are the minute they're gonna say is, well, what is your criteria to where just it's okay versus I really got to do this?
So it really depends on the patient's occlusion, and depends on what tooth is missing. So if it's a second molar, second primary molar, generally we hold that space because that's easily lost, and it's also typically in an area where you're going to lose space before the tooth that has to come in.
And isn't that the only baby tooth bigger than the permanent replacement?
Yes.
The primary second molar.
Yeah. So the primary first molar is sort of a gray area. It depends a lot on what they have behind that space, meaning if they have their 6-year molar in already and they have the second molar, then oftentimes you don't need a space maintainer, assuming they're in good occlusion. So if they're a class 1 occlusion and they have those 2 teeth, then by the textbook, you don't really have to hold space. But that's sort of like a quick rundown. I think actually Wave on Dental Town has a great, if anybody wants to look it up, I think he has a great flow chart of how and when to do space maintainers. That's Dr. Wavell Wells.
Wavell Wells. Huh. If you find that link, will you send it to me?
Sure. I'll take a look and see if I can find it.
Because there's only 5,831,000 posts. I mean, for me, it's so hard because now you start searching an exact keyword and you find 20 pages of that. But that's why I think Dental Town is still my favorite. Not because I own it, but like if you had this a nice case on Dental Town, or say we were talking about the blunderbuss, and I told my friend, I said, oh, go to his Facebook page. Well, what is he supposed to do? Just go there and scroll back for eternity until he finds it? I mean, if you look at social media, I mean, Facebook, Instagram, they're all laid out for LIFO. Last in, first out, entertainment. It's fun. You get to scroll through. I love Twitter and things like that. But when you're looking for something specific, I just love message boards. It's just an easier deal. So what has got you, so now I shouldn't have even talked about pediatric dentists with you, even though you're alleging that, because I know everybody wants to know about COVID. They're scared that, they're scared because, they shut down the dental offices here in Arizona from, it was, St. Patrick's Day to Cinco de Mayo. So everybody went to a donut. And when I podcast the president of ADA, it's like, yeah, that's a problem. But another big problem we're having is a spike in suicides with dentists. And we have a big threat on Dental Town. And there was one here in my backyard just last week. It's scary times. And they were talking about, that there might be a fall wave. But now the epidemiologists that I'm listening to are saying that, no, the waves, no one talks about that anymore. That was H1N1, and there's no sign of any wave activity. And what they mean by wave activity is that when the virus the cases start going down without any change in the humans. So if the humans are doing everything the same, but the cases go up and down, that's a wave. And they say that is H1N1. But they're not seeing a wave, and it's they call it just a burning inferno. But what scares me is yesterday in Colorado, the health commissioner traced back some cases to a dental office. And if that's so now some dentists are thinking, are we going to have to close again? So my specific question to you is, you're out there in New Jersey, right? And that was one of the worst states. I mean, you guys have had like one of the highest death rates. If you go to that Worldometer, I mean, you're as bad as it gets in New Jersey.
And we're actually in Bergen County. We're probably the worst part of New Jersey. That's where my practice is. So it was pretty terrible.
Congratulations. You're a winner. You're a winner. So my question is, it's August 5th right now. Are you thinking that, are you thinking that you might have to close down again sometime in the fall, or you think we're past that and we've proven that with PPE and air filters and all that we're like a hospital, and the only people that are going to get closed down are going to be bars and restaurants and gyms? But what about your pediatric dentistry? Do you think there's a real threat that you'll have to close?
I think there's a possibility. I feel like everything I've seen online and anything I've read has been pretty conflicting throughout this entire process because it doesn't seem like everybody knows exactly what's going on. So I definitely think it's possible, although it does seem like the areas around here, at least that had it, don't seem to be changing at all. I have a lot of patients whose parents are EMTs and work in hospitals, and I ask them sort of, what's your take on it? What are you seeing? And one father said, oh, in our city, COVID didn't happen. It's done. He said there were a lot of numbers, some deaths, and then it disappeared and everybody's back to normal. People aren't even really wearing masks anymore. They're not really social distancing, and we're not seeing any cases at all. He says, I haven't had a call in a month for a COVID-related call. So I really don't know if that means that it's gone because of, specific herd immunities maybe in some areas. But I don't know. I definitely think it's a possibility, but I'm hoping that when it gets to the next phase, if there is a next phase, people will know enough about it to say, hey, you don't have to close, but you need to do these things to prevent any spread.
What did you change in your infection control protocol that you're still going to be doing after the pandemic?
Good question. Not much. We did change a lot of things that I don't know if I'm going to keep. We don't really have a waiting room anymore. Everybody stays in their cars. And when they get there, they call us and we walk them straight into the rooms. We are using a hypochlorous acid foggers between patients. We have air purifiers. The air purifiers I'll probably keep because, getting rid of the particles in the room aren't going to hurt for sure. The PPE obviously is very, very hard to work in, especially with pediatrics because they're used to kind of being near us and seeing us and being really close. And now there's not as much of that. And, they see us under layers and layers of equipment that looks a lot scarier than we used to. So I'm hoping that at some point we can cut down on a lot of that. At this point, we're wearing way too many layers.
So do you play him a lot of videos? You have like the movie Frozen playing and things like that?
So we have TVs actually over all the chairs, and we have every option of everything. So whatever
how
they
many
want.
times have you had to see Frozen?
None, unfortunately, because I hear it and I know it by heart, but it's always above my head. So I don't even know what's going on. So I can probably say the entire movie, but I have no idea what's going on when it's happening.
Oh my God! When my granddaughter, she had a phase where every time you walked in the room, we had to watch Frozen, and it's like, oh my God! I think I'd rather get beat up by Mike Tyson than see that one more time. I'm trying to think of how much trouble I want to get you in, but the other real controversial thing is Medicaid. I've always recommended not getting involved with them because you have people make mistakes, and if you make a mistake with Delta or Blue Cross or Blue Shield, they call you up, they audit you, money goes back and forth, they might, spank you or whatever, but my God, you screw it with Medicaid, you're going to go to jail. And I don't play with people where it's like I wouldn't know why people would want to have an illegal drug operation because your partners are all murderers. Well, that's the relationship the government is. The government is just a bunch of legal thugs for 5,000 years. In fact, when people debate over governments, it's like they've even read a history book. Every government started with a military victory and bloodshed and ended the same way. So in between the first and last victory, if you want to call it whatever, it's the same old. I don't do business with people who, my mom taught me that you should never kidnap people and hide them in the basement and kill them. Well, that's what the government does. And I like a speeding ticket in advanced countries. If a cop's behind you, calls in your tag, and your insurance expired, they would enter that in the computer and they would mail you a letter. Not in America. We got to pull you over, walk up to your car with a gun, and then that can go south. And Medicaid. I had a friend, a good friend. And he just passed away a couple months ago, and he was his wife was a dingbat, and she screwed up a bunch of Medicaid stuff, and turned out been overbilling for 10, 20, 30 years on a couple of codes. She was the most adorable woman. She was just a dingbat. And the lawyer said, the best I can get you is 5 years in jail. So he had to go move to Mexico. And by the way, when you go on these cruises in Mexico, when you pull up to Cabo and Acapulco, whenever you go to southern countries from here to Argentina and you meet American dentists, when they tell you, well, I just really liked fishing and I liked the weather, bullshit, more shit piled higher and deeper, you're running from the law. And it's just really innocent people go to jail because they're doing business with the government. And that's why I don't do business with the government. But what do you think about Medicaid? I mean, it helps the poor, but unfortunately, it's the mob helping the poor. So how are you a Medicaid provider?
So I'm not. It was difficult to make that decision. New Jersey, as far as I know, is one of the lowest reimbursement states. And I just felt
Is it that, or you just don't like kidnapping? You don't like being kidnapped?
Well, it's all of the above. It was that plus there was no benefit at all to doing it. So, I mean, for me, we do charity care to some extent in our practice. And when patients do have Medicaid, we try to work with them as much as possible. But I just felt like for me, I didn't want to be kind of stuck in all their rules, which are worse than, the regular insurance companies. And I didn't feel like I would be able to care for my patients the way I had to if I was stuck with that. So it's a mix definitely of both, but for me there was no benefit in any way to do that, even though I do feel bad because I do feel like the population that needs it, but it just didn't make sense for me to do that when I opened the practice.
The other controversy in your department is they came out with CBCTs, and I've had a couple of radiologists on the show that cringe at pediatric dentists and orthodontists taking CBCTs on everybody. And she pointed out a lot of them that even have courses didn't even have a thyroid collar on in the course. She's like, my God, you're pushing these CBCTs. Your video doesn't even show a thyroid collar. There's a lot of radiologists, and I'm talking about maxillofacial oral radiologists, that think it's too much radiation and you got to have a thyroid collar, and that if someone thinks they need a routine CBCT on kids, even for an ortho workup, they get very upset with that. What is your thought? Do you think these CBCTs are too much? It's too big a gun. It's like an elephant gun to go quail hunting.
So I don't know enough about it to be able to tell you one way or another, but I do lean towards less radiation is always better. The newer digital type of systems are not using as much radiation as older CBCTs. But the orthodontist that I send to, there is one that does it pretty frequently. I personally, if I was doing that, would probably only do it case by case if I needed it versus on everybody. But I don't know enough about, any, the long-term risks from doing it routinely versus not.
And I wanted to, a lot of the young kids, when you're confused, I look for red flags. And one of the red flags I first saw when I got out is the biggest names in cosmetic dentistry. They just file down all the teeth for crowns and all this kind of stuff. But then when their daughter asked for a smile makeover, she had to do 2 years of braces and bleaching and some direct bonding. And I'm like, wow, if that would not have been your daughter, it'd have been a completely different treatment plan. So it's always, religion got it right the first 5,000 years. My oldest sister is a nun, and she told me the golden rule: treat other people like you want to. It's the only thing that shows up in every religion. It shows up in Hinduism, Judaism, Christianity, Islam. I mean, every religion has that golden rule, and it really is. My dad taught it to me differently. He taught me whoever has all the gold rules, but my sister, the nun, says that. But yeah, so I think that's the easiest check for me. I mean, when you don't know what to do, I mean, your first question is, what would you do on yourself? The next one's like, what would you do on your 4 kids? But that can go south. So what you say is, what would you do on your grandchildren? Because the only reason you should never kill your children is because someday they'll make you grandchildren to make up for everything they did. And my God, my 4 boys made me the 6th best grandchildren in the world. Was there any, I don't think pain med's really an issue for pediatrics. I mean, kids don't get addicted because you gave them Demerol or something, do they? Or
well, in theory, they may be able to, but they don't really have access to kind of follow that up. So they don't have the option of continuing with the medication even if they were going to get addicted to some extent. So, I mean, I haven't prescribed a narcotic since I graduated dental school.
And then the other big thing that everyone wants to know is are you doing teledentistry?
So we were when we were closed for 3 months. I actually did some fillings and extractions in my driveway because patients wouldn't come into the office. But I opened the office a few times for emergencies, but we were doing teledentistry. I just didn't feel like it was that helpful. In many cases, there wasn't much we could do. But we did have, there was actually a pediatric dentist who set up a teledentistry page, helped me out with that, so that patients could send pictures and little videos of what was going on. And then we just discussed things over the phone afterwards.
I know we went over an hour and it's late at night over there. Do you care if I do a couple more overtime questions, or do you need to
go? I have some time.
Oh, okay. Another one that kind of compares you. It's a specialist. There was an orthodontist in Arkansas that, putting the customer first, like the orthodontist, they send them to your practice. No, you got to go send them to the orthodontist to take off all the wires and bands, and they come to my office, get their teeth cleaned. Then they go back to the orthodontist, and that's not patient-centered. So he brought in the hygienist, and who attacked him? The dental board, the Arkansas dental board, and then he was a type of guy where he wasn't going to back down, and they went to blows. You're an orthodontist. You're a pediatric dentist. But what did you think of that move? Do you think an orthodontist should be able to legally have a hygienist?
I guess it really depends on the situation, because in theory, it would be great for them to have somebody cleaning those patients' teeth more than just once every 6 months. I think the problem becomes more of an issue if there's either a payment from the parent issue or an insurance sort of frequency issue, where he's now doing the cleaning, so the dentist won't be able to do the cleaning, and now you're supposed to be doing an exam on a patient that you can't clean their teeth, that you may need to clean to be able to see what's going on. So the issue is, I feel like if you're doing the cleaning without the real exam, then you're kind of messing up the patient's care a little bit.
And it's really weird. Let me just tell you how incentives matter. I put a poll on Dental Town. Do you think hygienists should be allowed to have their own dental office? She's an American, 4 years of college. Can a red-blooded American have their own business? And half the dentists on Dental Town said no. And it's like, and then some of these guys are the ones always ranting on communism and how bad government is. It's like, dude, you're the communist. You won't even let your hygienists have their own place. And then there's some dentists in Arkansas that didn't think a hygienist should be allowed to work in an orthodontic office. Some of this stuff is just crazy. But back to that deal, treat other people like you want to be treated. Google's motto was first do no evil. And I think that the other motto is have a patient-centered practice. Just ask yourself, well, what's best for the patient? Would you want to go to a orthodontist, take it all off, then to my office, get your teeth cleaned, then go back and have it put on? Or would you rather have one-stop shopping? You know what I mean?
Right. So, I definitely understand the one-stop shopping. I think it becomes more of an issue if you're kind of separating the dentist who's doing the exam from the one who's doing the cleaning, or at least having the cleaning done in their office, so you can, do the exam and get, a correct treatment plan and see exactly what's going on with the patient. And in theory, I think that if the orthodontist was doing the cleanings for free and not billing the insurance so that the dentist could do the cleaning when he needed to, it may be a little less of an issue.
Yeah, because most all the laws in dentistry don't start until a dollar trades place. The lawyers always tell me that on the podcast that, well, she came in, she did all these things, but you never charged anything, no money to place, and all the crimes just started out. That last one was a big segue for my last question is, I like business. I like business models. You know what I mean? I got my MBA, and it seems like from when I got out in 87 to now, your business model of pediatric dentistry, the most growing fastest business model is combining pediatric dentistry with ortho. And that's kind of that one-stop shop. It's kind of like all in one thing. We were talking about, space maintainers, ortho. Do you see the trend moving forward that, another generation pediatric dentists and orthodontists are going to be kind of like the produce and the meat department in the same grocery store?
I think so. It makes a lot of sense because pretty much most patients that are going to the orthodontist are probably getting sent there by pediatric dentists in areas where there are pediatric dentists. And I think it makes a lot of sense to have them all in the same place. I know our patients have asked for a long time, when are we bringing an orthodontist in? So it is something that I've thought about and discussed. We haven't done it yet, but I think it does make life a lot easier. When I was an associate, I was working for an orthodontist in his practice. So it was both of us together, and, we can run cases by each other. If he sees an issue that's dental, he can speak to me. If I see an ortho type of situation, I can speak to him. It just makes life a lot easier.
So why don't you just send Deborah to night school and make her be an orthodontist?
She just had her third kid 3 weeks ago. I think her husband would kill me.
So my last and final question, do you got a magic trick for us? Come on, dude, you got 100
Sure.
million views. 100 million views. I'm not leaving till you do at least one magic trick.
All right, I'll show you one. Hang
And
on.
you got to fool Kyle. Kyle can't figure it out.
All right,
or,
I'll try.
Or you'll have to do another one.
All right, let's see if you can see me from here. So this is one of the favorite ones that the patients like because they do it with me. But basically, empty book, color some pictures into it. Not empty anymore. If you take some
Nice.
crayons from the side and throw them in the middle, then it gets colored in. You shake it, gone.
Nice.
This is a very easy one to do. So for me, I'm definitely not a magician. So my tricks have to be really easy and really visual quickly. So we have drawers full of tricks that never worked out.
I only tried one magic trick. You know that deal where they put the assistant in the box? They saw her in half. I did that one and she died, and so we just we
No
don't
more
do
for
that one anymore. Yeah, we gave up on that trick. But hey, man, I'm a big fan of yours forever. I can't believe you've been a townie since 2004, and you don't even look old enough that you even got out of high school, and you've got
Thank you.
2000 posts, 2004. But seriously, man, thanks for all you've done, and seriously, thanks for all you've done with dentistry, because it seems like all the news in dentistry is bad. Like if dentistry is in a movie. I mean, even when it was Jennifer Aniston, I mean, what could go wrong with that? Oh, well, it was incredibly wrong. She was the worst dentist in the world. Dentistry always has a bad image, and then to see every time yours comes out, to go in the comments wherever it is, and it just ooh and on. I mean, you've done more for the positive side of pediatric dentistry than anybody I know. I don't even know who would be number two. I mean, if it wasn't you, who would it be? I mean, it's you. I mean, 100 million views, NBC, nightly news, and all that stuff. So, man, thanks for all that you do for dentistry. Thanks for all that you do for Dental Town, and it was just an honor to podcast you.
Thank you very much. I really appreciate it.
All right, have a great day, buddy.
All right, thank you very much.
You know where it is? Watch this, look. You know what we're gonna do? We're gonna make the light not so bright. Watch. Now watch. Right over here. Comes it over here. Where is it? Do you have it? Check your hand. Is it on the chin? Let me see. You wanna hold it? Where'd it go? Oh, you got it. Check your hand now. Look. Look on your hand. 1, 2. 1, 2. Where is it? Can you throw it to me? Throw. Oh, got it. Then chop it in half. Like, oh, now we have 2. Wait, hold 1. And roll 2. How do we get another one? Go like this. Oh. Get it. Oh. Got it. And then you roll this one. And then you hold this one. It's gone. Oh, another one. How do we do that? Then we have to blow them out so they disappear. Go. Okay. Blow. Gone. Is that cool? Is it in there? Oh, got it. Hold that. And it's gone. Say bye.
Bye.